12.5, waiting on the start. And we are now live. KLEK 102.5 FM. Good afternoon to you. For those of you watching on our live stream, I do apologize if I have a little bit of an echo. That's just kind of the technology that we're dealing with because we are streaming live. But currently, this is a forum, COVID, speak up, COVID-19 in the Black community. It is sponsored by the Craighead County chapter of the NAACP and the Arkansas State NAACP. And today, our panel is going to talk about COVID-19, but specifically how it affects the Black and minority community. So I want to introduce the people who will help me to moderate this forum today. We have first Miss Dominique Phillips of Arkansas State University. So Dominique, if you just maybe like to say a word or two.
Hello, everyone, and thank you to Dr. Speights and Dr. Brookshield for your time.
All right, and next is Mr. Tony Thomas. All right, so Dominic, would you like to start us off? Bring it with introducing Dr. Speights.
Yes, so Dr. Speights, we first we have several questions from NAACP Instagram page, and we kind of wanted to see your perspective and your advice that you give to the students. So I'm going to pull up the question, and I'll start with this. Okay? And this is what we will do. So a student asks, is the only way to test for the virus using our flu that we have?
So, no, there's a couple ways to test. There is the most common way that we test, the most common way that we'll continue to test, it is by the nose. And it's actually the front part of the nose. So, contrary to popular belief, we don't have to ram this thing all the way up to, where your brain is kind of thing. It's just more of a swab to the inside of the front part of the nose. And the idea is to try to get pieces of the virus to test and see if it's positive. There's a blood test called an antibody test, but I'll be honest with you, we're not widely using that, and we're not widely recommending that right now because it doesn't give us the information we really need. It's kind of questionable. We need those tests to get a lot better before we start using that widely. So to answer the Congress question, if it is a nasal swab, no, it should not be painful. You should not have a painful swab to get that done.
All right, Dr. Speights, before Dominique goes to the next question, because we didn't actually get around to it, could you just kind of give a brief opening statement on where things are standing right now? Then I think after that, I think you said you wanted to hand it to Dr. Laurent.
Absolutely. No, first of all, thank you so much for having us on. I know I think Dr. Laurent and that we are happy to be able to provide educational information, good solid information in this time where, really you can go to Twitter, Facebook, or the internet and find all kinds of things that may or may not be true. So people know that we're here to try to help tell them this and really set the record straight on what we're concerned about.
For those who watching our live stream.
So, here again, I know a lot of people are bringing all right now. We are seeing most of what we're talking about seeing uptick in cases. That is something we primarily expected as the state started to open up. Some spots of the state, economically, we weren't doing well. We want to get back to work, we need to get back to our jobs, we need to pay rent, buy food, that sort of thing. But the virus is still circulating around. So what we're doing now is we're trying to open back up as safely as possible. And hopefully get out that good information so people can protect themselves and protect their families. Those are the main opening points I want to do.
Okay, Dominic, we'll let you go to your next question. I'm having a little technical difficulty on the live feed, so I'm going to have to fall back for this for a second and let you all take the lead and answer the questions while I figure this out.
Okay, so the next question from the NAACP Instagram page is,
a new study just came out actually today talking about the surgical mask. So this is somewhat different from the face than the cloth mask. It does carry information that's important. And 70% of it reduces the risk of being infected by 70% by wearing a surgical mask. Now, the truth is, if you're wearing a face mask like a cloth one that you make yourself, one that meets a recommendation in terms of being able to prevent the spread, you're still probably limiting your chance of getting the virus by 50 to 60%. That's better than nothing. And so I'll be honest with you, certainly for me and my family, we wear a mask out in public. It may not be popular, when we go to Walmart or Kroger, but at the end of the day, I've got elderly in-laws, we don't want to carry things home to them. We're social distancing, we don't want there to be a chance of that. And so, me and my family, we're in the cloth masks. In mine, it would be a protective cover. I'm going to y'all need
No, I think echo what Dr. Speights said. I think there's been a lot of stigma around wearing the mask. I think it's probably one of the best ways that we can express to one another, especially in our community, that we are taking care for one another, which is why we're wearing masks. We care for our neighbors, our family members, and for ourselves. And so if we can kind of
And at this time, Dr. Laurent, if you have any key points that you would like to add in.
Sure. Again, here at NYT, we're very grateful that we have an opportunity to serve our community when it comes to addressing health in every population within our health, specifically within minority populations. So it cannot be denied that there are disparities in health outcomes. We do see that within minority groups, there are higher rates before the pandemic. Before the pandemic, there was a higher rate of cardiovascular disease, hypertension, diabetes, and obesity. And because of this, unfortunately, it has made Black community even more vulnerable to have the more severe course of this illness. And so that's why we are concerned. But I want to bring some light to that, and also in alignment with what NYIT is here to do. So we're here to teach students to become physicians and leaders in their community and to understand the context of their community. They can't just take care of patients and not know what's happening in their community and about their family context. And so one of the key things we teach our students that we want them to teach their communities is that the way our health outcomes are, the way our bodies operate, is based on the conditions where we live, learn, work, and play. So, an example of this that I would like to kind of hone on is there's been a phrase going on throughout this pandemic stating that we're all in this storm together, but we're all in different boats. Okay. And I want to kind of bring light to that. Like some of us literally could be in submarines. Like we're deep underneath, we're laying down, we're relaxed in our submarine. We're not feeling the sense of the top of the storm. Some may be in a yacht, some may be in a canoe, some may be on a lifeboat. Some people may be on a raft. Some may not have a boat. And I want to extend on that analogy a little bit. So what we teach our medical school is to our students is teach them about why do people end up on the boat that they're in to begin with, right? And it's not by accident that people have certain boats. Science tells us that there are policies, laws, and interventions, whether overtly and inadvertently, they shape the conditions of our communities, where we live, where we learn, where we work and we play. And it doesn't give everyone the same opportunities to do well within the storm, all right? And the categories of populations can be expansive. It could be within urban, rural, socioeconomic, it could be gender, ethnic, and racist. So all these different populations, based on the policies and the laws and the interventions around us, affect the boat, created the boat, essentially, of what we're in right now. So it's not like, Black people have different lungs and, white people have different lungs and hearts. No, the conditions in which we live in affects us. It affects how likely we're going to get ill and how we respond to these illnesses, these chronic stresses that we experience. And I think that speaks to why we're seeing the disparities right now amongst different populations. And lower socioeconomic individuals, regardless of race, right now are experiencing this storm in a very significant way. And so I think what the COVID-19 pandemic is showing us is really highlighting what's already been in the current undercurrent and what's going on in our nation and really just globally as well.
All right, wanted to interrupt right quick. I actually had to put this on the air on the radio in order to get the audio corrected on the online. So we are actually now live, not only just on Facebook, we're also live on KLEK. So if you are listening on 102.5 FM, you are listening to COVID-19 in the Black community. It is a forum sponsored by the KLEK County chapter of the NAACP and the Arkansas State chapter of the NAACP. And our guests are Dr. Brookshield, Laurent, and Dr. Shane Speights of the NYIT Osteopathic Medical School on the campus of Arkansas State University. And if you're watching on our Facebook live feed, you can definitely leave your questions and your comments. So let me share with a few more people, and I'll come in with my next question. Did any of our other panelists have a question? I see we have Mr. Freer on. I see we have our own Quabila on. So if anybody else has a on the panel,
question for Dr. Brookshield.
Okay, go ahead.
You explained, Dr. Brookshield, Laurent, that the disparities affect the kind of vote we're in, and that's the past. I'm wondering if the present is now relevant as well in terms of access to testing, access to treatment. And I understand in the past there have been differential treatments available to white people than to black people. Do we see a difference there as well? Not just in their vulnerability, but in the way black and brown people are being treated now.
Yeah, the access question is very interesting, and there's twofold to this. So there's a lot of different ways we have access. Access could be due to having insurance coverage, okay? Yes. So if a person is not enrolled in Medicaid or Medicare, for some reason there's a barrier to getting that type of access to get coverage, that can be a barrier. So you can imagine if you didn't have access prior to this to get care, it may be more difficult to get it in this acute stage. So however that way it was before, you can see that translated into this current moment. Another aspect about access is when we're putting, for instance, there has been stations across the state where there is universal testing, right? Forest City was doing universal testing. They're trying to expand that. And we're hearing in certain of our social media platforms that there are trust issues within minority groups about getting testing. So although it's there and it's available, and because of either historical or things that people may be experiencing within the medical community, they may be leery and say, should I trust this? Should I move forward and get tested? And I think that's a very difficult dynamic. You know, there's one aspect about social determinants of health. That's the thing about conditions where we live, learn, and work and play. One determinant of health is social networking. Social networking is such a powerful, powerful thing. And what I mean by that is it's the group of people that influence our norms, are the way that we communicate with one another, the way that we think about the world around us, the way that we interpret information. And if you have a social network, whether physically, it could be a church network, a community organization network, it could be social media social network. If you're surrounding yourself by a network and that network is not healthy, you're most likely not going to be healthy too. And so if within the Black or minority community, we're in a network where people are not healthy, we're less likely to adopt healthy behaviors. Same is true of communication. If I'm getting communication from my network that is leery about health and leery about medicine and leery about, what trustworthy information is, we tend to believe those things better, right? Trust is what affects the way in how we function in life with our community members. So within that network, there's misinformation, that is perpetuating, and I'm believing that more than a healthcare professional or public health official, that will also be a detriment to our community members. So I am concerned about that, where there may be things available that people may not trust and want to trust other things besides what people or health professionals or population health professionals or public health professionals may be encouraging people to do.
All right, we got a question from our live feed. This comes from Carol Maxwell. She asks, does the mask cause blood pH levels to rise?
Yeah, so I'll kind of jump in on that one, and Dr. Laurent, you can add. So no, that's not true. So when we talk about blood pH levels, And there have been lots of myths floating around out there about these masks, and that, you know, if I rebreathe, if I'm sick and I rebreathe the virus, it's going to make me sicker. And, you know, or, you know, if it doesn't let me breathe at all. Now, the CDC does discourage the use of a mask for those under the age of 2. So those should not be used under the age of 2, because really the reason why is because they're not old enough to pull the mask away if they have trouble breathing, or they get it covering their face and they can't breathe well. Now, the mask should not be tight-fitting. It should not keep you from breathing. It should be loose, and the idea behind it is just to prevent your respiratory droplets, your water droplets that you're breathing in and out, that somebody else might be bringing into you, just kind of create a barrier. But it does not change the pH of the blood negatively. So I hope that helps.
All right, let's bring it back to Dominique. Dominique, let's get another question from the Instagram from the NAACP.
Okay. Another one is, isn't COVID over? They've reopened businesses and cities. Also, while if, I'm sorry, this is worded wrong. So what we'll say is, isn't COVID over? They've reopened businesses and cities. Let's go with that.
Yeah, thank you, Dominique, for bringing that up. And I'll tell you what, that's probably one of the biggest things that the biggest myths we're trying to dispel right now. In a perfect world where everybody didn't have to worry about money, you didn't have to worry about paying rent, didn't have to worry about, you know, paying your mortgage and getting groceries and that kind of thing, we would all still be at home. But the truth is that people have to work. And the truth is that, you know, we've got to have things that keep moving things forward, in terms of people picking up trash or picking up your trash. I mean, all these things that have to happen to keep your economy moving, and to keep the city moving and the county moving. Those things have to happen. And so we got kind of caught in terms. We had to reopen things to help move the economy forward. And that's kind of the conversation. The virus didn't go away now, even than we did before. And so we've just got to be real careful about it. As we open up, we continue to practice the social distancing measures that are put in place. So things like wearing a face mask, like maybe keeping some alcohol-based hand sanitizer in your car, making sure you're washing your hands good. You know, when you little things like keep a napkin or something in your pocket when you're opening doors. Use that as opposed to actually holding the door. So the virus is spread back and forth in the air. It's also spread as people touch their face or touch their mouth and touch something else and then you come along and touch it and don't know about it. You get infected. That virus can hang out and live on like wood and on metal and things like that for days even. And so we want people to be protected and be armed with the educational knowledge so that they can protect themselves. And so the virus is still here. The virus has not gone away. But we as an economy, we as a state, and even as a country, we got to start moving things back to some sort of normalcy, because we financially can't afford to not do it. Does that help?
Yes. So another question is, A-State students just received an email not too long ago from the chancellor, and he has announced his plans to move forward with opening campus back up in the fall. So from a student perspective, what precautions can we take to ensure our health, especially in the classrooms and in the class and the flex areas?
I think that's a great area, a great question right there. And I think certainly what ASU students need to know is that ASU is partnered with NYIT to be able to set up processes, policies, and procedures to keep students, staff, and faculty safe. And I'm proud to say that Dr. Laurent is co-chairing the committee in terms of working between the two institutions to make sure that all of our physicians and all of our resources that we have at NYIT are going to be put forth to make sure that ASU opens up successfully and safely. So, you know, this is one of those times where having a medical school in the middle of your campus really becomes beneficial. Most institutions don't have that luxury, and so we're happy, again, to be such a great partner with ASU and to be able to provide this kind of service during this time. I don't know, Dr. Laurent, if you had something you wanted to...
Yeah, you know, the same recommendations that we've been given by the CDC right now in terms of these basic personal things of steps of prevention is what we're going to encourage everyone to do. And really, you know, we have to hold each other accountable to that, right? We care for one another. We have a community, right? So if you're feeling ill and you're feeling sick, don't go to class. You know, call the clinic, call the doctor, and start a conversation to see what to do next. Certainly, if you are becoming ill, there should be things in place that will make sure that you get the support that you need. Washing your hands, keeping social distancing. Listen, it's hard. You're in school, you're going to see friends, you're going to want to high five, you're going to want to gather. And I think what's important that our students need to keep in mind is that it can't be that way, at least not for a very long time right now. We are going to have to be distant and not be close to each other physically, and think of new and creative ways for us to connect. Because as what's been stated, we do have to move forward, but in the safest way possible. So I think what we can do, and leaders such as this organization on campus, is, hey, how can we support our community to say, how can we be healthy and be safe and make sure we stay connected? And if our student leaders can start thinking about ways to do that, right, whether it's banners and signage or cool apps or anything like that, to say, hey guys, we want you to be safe. And I also want to let people know that there's kind of like this false sense of security that if I'm young, I'm going to be totally okay. Like, I don't have to really worry about it. And that's not necessarily true. There has been reports nationally that younger people are becoming ill due to COVID-19. They're presenting a little bit differently, like strokes and blood clots that are showing up in their bodies. So we just want to let people know that we don't know what happens when you get this over a long period of time. Even let's say you get infected, you recover, we don't know what happens 5 or 10 years later in your body because you have that infection. So we really do have to be precautious about this. We have to take these precautions. So I would encourage student leaders to start thinking about right now this summer. We will have this new normal. What does that look like when you have your student organizations, and how do you support your community at this time?
Once again, we are speaking with Dr. Brookshield, Laurent, and Dr. Shane Speights. For those of you just tuning in on 102.5 FM, this is Speak Up, COVID-19 in the Black Community, sponsored by the KLEK County chapter of the NAACP and the Arkansas State chapter of the NAACP. And you can follow along on our Facebook Live feed. I actually want to go into a follow-up question, and I have a question that kind of ties into it. Kara Maxwell says, doesn't viruses come through those blue and white masks? And then I would like to add, there are some that believe wearing a mask in public actually weakens your immunity over time to not just COVID-19, but other diseases. So what's your response?
So in terms of the mask itself, that's a CDC recommendation. So they put out the guidelines in terms of what they think ought to be safe for everybody, to protect yourself and protect others. And so, in terms of does the virus get through the mask, it depends on the kind of mask. The mask that you see healthcare workers, nurses, and doctors wearing in the hospital, that N95 mask, you hear about that? No, it doesn't really penetrate that. In terms of the surgical mask, maybe a doctor or a nurse uses in the operating room, you've seen those. It protects you about 70% of the time. Now the number keeps going down depending on the kind of mask you've got. The cloth mask, like my daughter makes me, those are probably 50 to 60%. And you say, well, that's not real high. Well, that's true, but it's not as high as nothing, so to speak. So in terms of not wearing anything, so it's really better than nothing. We don't have a lot of the big N95 masks because those are in hospitals and in clinics, because we need our doctors and nurses who are taking care of all those sick COVID patients. We need them to have that, and we feel like they're probably going to need more of that as this goes on, and they're kind of in short supply. So we're trying to save that for the really sick people and all the frontline doctors and nurses that are taking care of them. And that's why we say to the general public you should be using a cloth mask. I mean, that's why I wear a cloth mask as well. In terms of it lowering your immune system, that's not true. And one of the things I'll say, and Dr. Laurent she and I talk about this frequently, we need people to try to get good information and go to respected and trusted news sources like the CDC, the Arkansas Department of Health website. Those are good places you can trust information. I mean, and obviously, we try to put out good information as we can through the Delta Population Health Institute that Dr. Laurent oversees, and through, obviously, NYIT College of Osteopathic Medicine, we put out information as well. But no, it does not lower your immune system by wearing a mask. As a matter of fact, what it does is it protects you and protects others from getting this virus. We in the healthcare profession, the physicians and the researchers and the scientists, we want to do the right thing. We want to do the right thing for everybody. We want to do the right thing for for my wife and my kids and my family and your kids and your family. And so that's why we're on here today. And that's why Dr. Laurent and I are, we take time out to do things like this. It's because it's so important that good information get out to the public. Because gosh, it's hard to wade through it all when you just look at Facebook or Google something or go to Instagram or something like that. And Dr. Laurent, I don't know if you had something you wanted to add to that as well.
Well, what I want to add to the face coverings is that that because you have a mask on, it doesn't mean you still don't do the 6 feet distance. Okay, the way to improve the blocking the transmission is the mask plus the. So it would be best whenever you're putting the mask on, it doesn't mean it gives you permission to be very close to people too. It's there just in case you happen to can't get away from close gatherings, but you also always want to add on top of that that you're separate 6 feet away from people with the mask at all time. And that's how you can further improve the efficacy of the whole process for prevention.
We just now joined by Mrs. Emma Agnew, president of the KLEK County chapter of the NAACP. Mrs. Agnew, did you have a question for our panel? Want to make sure we give you an opportunity to weigh in. Ms. Agnew, please unmute yourself. All right, go ahead, Mrs. Agnew.
Yeah, I apologize for being late, but glad I could get in on part of the conversation anyway. So I hate to come in like this and not knowing what's been asked and what's been talked about, but I do have questions. So if they've already been covered, just let me know, and I have no problem going back watching the video. But I did want to, this whole thing is about COVID-19 in the Black community and why it is disproportionately high and for African Americans and particularly communities of color than in others. And I'm under the assumption from what I've read, saw, and heard that there are myriad of reasons for this. And one that we determine as the NAACP is, of course, being absolutely educated on the idea, because when it first came out, some folks had the notion that Black folk couldn't get COVID-19. I don't know where that came from, but and so I would, like to ask our guests, our panelists, if they would address some of the additional reasons that it's higher in the Black community, and if there are some things, some practical things that we can actually do as an organization and as individuals to address some of that.
Before the answer, I got to pause for a station identification. This is KLEK LP Jonesboro, broadcasting from the First National Bank Tower. And now, if you're listening on 102.5 FM, you are tuned into a live forum, COVID-19 in the Black community, sponsored by the KLEK County chapter of the NAACP and the Arkansas State chapter of the NAACP, with our guests, Dr. Shane Speights and Dr. Brookshield Laurent of the New York Institute of Technology, Osteopathic Medical School on the campus of Arkansas State University. So now, Dr. Speights and Dr. Laurent, you can answer Mrs. Agnew's question.
Yeah, so Ms. Agnew, thanks for asking the question, and I'm more than happy to go over that. So, prior to the pandemic, there was already a prevalence of many medical chronic illnesses within minority groups and specifically the Black community. Heart disease, lung disease, smoking or obesity or diabetes. And as we have learned, the coronavirus seems to have a more severe course of illness in those who have those chronic illnesses. And so if you can imagine, even before the pandemic, if a baseline within a community where you had a significant amount of people with high blood pressure, diabetes, heart disease, etc., you certainly with this illness on top of it, it would show, and I'm, from a physician's perspective, I'm not surprised that we have these outcomes right now. The disparity was there before because the illnesses were significantly disproportionate before the pandemic. And so you have a virus that is affecting those who have those illnesses more severely. And so we will see those things as well. So that's that at baseline. But secondly, our response to the information, our response to what type of information we're listening to, our response to how we're getting information also affects how we can change the course of this as well. So if within the Black and African American community, we tend to, if we are not trusting resources and not trusting resources or what is being heard, or we're following, you know, certain conspiracy theories online, and that is what we're following primarily instead of following things from the CDC or the Arkansas Department of Health, you know, then we are actually doing more harm on ourselves. Understandably, that our social networks is probably one of the best um, things of resilience and community. Social networks are important. It is the way that we are strong within our community. We have strength in our community, but I'm seeing that our social networks are backfiring on us based on some of the responses, unfortunately, that we're seeing online. People who are perpetuating false responses about COVID-19, encouraging specifically Black people not to get testing. And, you know, and we're finding that communities or organizations that are advocates for Black communities are forwarding and sharing these comments instead of saying these comments are not appropriate. It's actually more going to cause more detriment to our community, and encouraging people to go to the CDC and encouraging people to get tested. So I'm concerned that at this time.
Is somebody watching the news in the background? So we could please turn it down or mute yourself.
It might be me. Let me mute.
Well, and while I'm on here, before we let Dr. Laurent finish and bring in Dr. Speights, I kind of just want to slight piggyback off of Mrs. Agnew, since Dr. Laurent was talking about hesitance in the Black community on getting tested. Also, whenever a vaccine is eventually developed, I've been hearing people in the Black and even in the white community that are saying, I'm not going to take the vaccine because of past history with such as the Tuskegee syphilis experiment, or government conspiracy, Obama, Bill Gates, whatever you want to throw out there. And so, you know, that's obviously got to be something that's of concern, that people, when there is a vaccine developed, that people aren't going to take it because of distrust of the government. Kind of just stacking on top of what Dr. Laurent was saying about the hesitancy for testing.
Most certainly. I mean, you certainly cannot deny historically what the relationship has been with, you know, health and healthcare with communities of color. We teach our students about the Tuskegee experiment. We let them know that. We let them know about what happened and what was put in place to protect communities from that after that time and on, so that patients or subjects of research studies will have informed consent. We talk about that very thoroughly with our students. It's something that has been in law now to protect our communities. It's unfortunate that, you know, this is continually perpetuated. And I understand that. I completely do. I see that. And I do, even personally as a physician, when I have my patients and their patients who are persons of color, I do spend time to explain some of the interventions that we have in place. As a physician, I do believe in the power of vaccinations. It's the best thing that we have. It's more effective than medicine. I'd rather do something to prevent an illness than you actually become ill. So, you know, getting ill, there's a lot of risk to that. You can die. It costs money to be sick. You know, there's a lot of other things. But if I have a vaccine in place to help prevent those things from happening, I encourage every one of my patients to get it. I get it myself. My family gets it. But it's again important that leaders within the Black community also get informed and share this information and build collaborations between healthcare entities and communities to have these conversations and dialogues, right? So it's not that I'm just telling you to do something, but we need to have a discussion about what it means and how it affects me. And this is how I've experienced it. I mean, even myself, who might be who's educated, I'll go to certain places, and the healthcare system can be so confusing. If you don't have someone who understands and is health literate, it's so confusing. On top of the distress, I can see why people would be turned away, but I do think it's our responsibility as leaders to open up that space, to have that dialogue, so that we make sure that people get the help and the care that they need.
Dr. Spice, did you want to add anything to that?
Well, just picking up on that thread that Dr. Laurent started, certainly I echo everything that she just said and agree wholeheartedly. One other piece that I would mention is that unfortunately, because of this pandemic, we've seen a significant drop off in the number of vaccinations of our kids during this time period compared to this same time last year. Probably over a third of the percent, so 30%, a third of the vaccines that were given, we've seen a 30% decrease versus this time last year. So that's significant. When we talk about our childhood vaccinations against measles and mumps and rubella and all of this, I mean, it really I shudder to think about a measles outbreak in the middle of this, as people have really foregone going to the doctor and getting any of those well child exams. You've got the adult population who's not doing screenings like they're supposed to for mammograms, for cervical cancer screening. We've seen a significant decline across the country. That's going to cause a whole different healthcare scenario and conundrum if we don't address that. So people need to feel good about going back to the doctor and getting their high blood pressure medicines taken care of and getting their vaccinations and getting their screenings done. Because, and Dr. Laurent said this already, and she's exactly right, you need to have your immune system in the best shape it can be. This virus is new, and it's new to the human race. So no human has had this virus before now, which means that your body's going to respond differently depending on human to human. By and large, for most people, it's going to be a pretty significant infection. What we mean by that is you're going to have a fever, you're going to have muscle aches, you're not going to feel good, and that can last for days to weeks. So you need your body to be in the best shape possible to be able to fight off this virus. And since we don't have vaccines and don't have medicines, that is basically, what that means is if you have a chronic condition, you got to be on your medicines. You got to be controlling your blood pressure, controlling your diabetes. You got to be out walking around the neighborhood, just kind of maintaining some activity. And you got to make sure you're up on your vaccines, because again, those will help protect you from other viruses. I said early on when we started talking about this, we were still seeing a lot of influenza, a lot of the flu, and people said, well, how does a flu shot help me from this virus? Well, it doesn't help you from the virus, but it keeps you from getting the flu on top of the COVID-19. And so I think those are the pieces that Dr. Laurent was trying to drive home, and I agree completely with what she was saying.
Appreciate that, Dr. Speights. And for those of you that are tuning in on 102.5 FM, this is Speak Up COVID-19 in the Black Community, sponsored by the KLEK County NAACP and the Arkansas State NAACP. We do have a couple of new people on our call. We definitely appreciate them for checking in. Carla, and we have our own Reverend Greg Ota. I want to bring in a couple people who we have not heard from so far. We have not heard from our own Quabila, and then see if she has a question, and also Dr. Lonnie Williams. So, Quabila.
Hello, everyone. Can you hear me okay?
Yes.
Hello?
Yes,
okay.
We can hear you.
My question is to piggyback off of what Dr. Speights mentioned about how people are not going to the doctor like they're supposed to because they're apprehensive about, what the virus can potentially do. And so I know personally a person who recently had surgery and they were sent home early. What about those individuals who, one, either need surgery, have had surgery or other procedures, and they're getting sent home? They may have in-home care. Again, the virus is going around. We don't know who has it because people are asymptomatic. What are the concerns and discussions happening in the medical community?
So specifically, are you referring to I know that there for a while, the governor had it so that elective surgeries were not being performed, but now that has been virtually lifted, so individuals who've had elective surgery scheduled can get those. Are you saying in terms of people that you feel like, or that they may feel like they're being sent home too soon from a surgery? Is that, I want to make sure I answer your question.
Yes, sir. I'm not giving away this person's information. She had a baby and C-section, and they sent her home 24 hours in 24 hours. And usually, from my experience, you are in the hospital at least 3 to 4 days just for monitoring.
Yes, ma'am. And so I can speak a little to this. Actually, I used to deliver babies, and I did C-sections. And of course, like a surgery, every C-section is different depending on how the patient responds in terms of how quickly they can get out the door. What I will say, and I've worked in the hospital for many years, people do better for the most part. And of course, this is a conversation between the patient and their doctor. For the most part, once you get out of the hospital, you'll do better. And the reason why is because all of a sudden now your risk for other diseases and other things that occur just by laying in a hospital bed go down dramatically. People don't realize this, but just laying in a hospital bed, all of a sudden your risk for blood clots in the legs goes up. Your risk for pneumonias goes up. So there's a lot of things by just laying in a hospital bed. Now, most hospitals have done a great job of combating that by getting you up and walking you around, that sort of thing. But to be honest, you're probably going to walk around a lot more at home than you are at the hospital. But things like even having the blinds closed in your hospital room. People get their days and nights mixed up. Now all of a sudden their immune system gets taxed because they're sleep deprived. And so there's all these things that happen just by being in the hospital. 20, 30 years ago, we used to say, look, put mom in the hospital and just check on her or tune her up. And we don't really do that anymore because we know that, there's a risk-benefit ratio there. And so without knowing specifically about the patients you're talking about, I would think that would have been a conversation. They were trying to do what was in her best interest and her baby's best interest because by and large, people do better at home. That's actually a national shift too. I don't mind to speak a little bit about that. So nationally, we're starting to see a shift really away from hospitalization and more for like home health and getting care at home. And so that's something that you may see more of certainly in the coming years. I don't know, Dr. Laurent, do you have anything to add on that piece? Or?
No, I think this another angle to this is, people are also fearful of going to the hospital, and we're finding that because of COVID-19, we're staying, Dr. Speights and I as physicians, diabetes, hypertension, strokes never went away. Heart attacks didn't stop because COVID-19 is at the forefront of our minds right now, and so people aren't getting the help that they need if they're sick. If their blood sugars are going up because of fear, and understandably there's a balance, but if you're at that point and you need to get care, please call your healthcare provider, talk to them. There's a lot of clinics that have switched over to telemedicine. There's a lot of clinics that have actually, started to open up and allow people to see in a hybrid model of telemedicine and inpatient care. So we're encouraging people to please do not run away from hospitals right now, especially if you need it. And I am concerned, we are concerned as physicians that people are not getting the care that they need because of the fear of actually going to the hospital too. So we do have to keep an eye on that.
All right, next I want to bring in Dr. Lonnie Williams. Dr. Williams, did you have a question? Want to make sure we get everybody an opportunity that's on our panel.
Thank you very much. I would like for you to speak more on the preventive medicine aspect. Dr. Speights, you spoke about a few minutes ago about exercise. I listened to our president, which is the worst person you can listen to about this, and what he says he's doing, taking every day, something that has not been proven whatsoever. Everything, not a shred of evidence that says has any effect. But speak to like vitamin C, vitamin D3, and the importance of that building up the immune system, especially for folks in the minority community who may have pre-existing conditions.
Absolutely, no, I'm happy to, and that's kind of an area of interest that I have is in terms of what can we do? Osteopathic medicine itself, the core of what we believe is that the body has the ability to heal itself if given the chance. So what can we as physicians do to help the body and encourage the body to heal itself? And it does. And regardless of the research you look at, the body does a much better job than we do with medications. To Dr. Laurent's point earlier, we talked about vaccines versus a medicine. Well, the vaccine, the idea behind that is you put a little bit of that broken up or a neutralized virus in there, and now all of a sudden the body sees it, and it recognizes it, and it creates memory cells, so if it ever sees it again, it can fight it off. And she's exactly right. I agree 100% with that. So in terms of nutrition and exercise, We know that increased blood flow in terms of moving around and staying, just walking around your neighborhood, we know that that helps your immune system. Just as we're all sitting here right now, really not doing much of anything except talking, we're only using maybe half, maybe a little more of our lungs. You're not using all your lungs, and most of you guys know that. If I had you jog down the road and jog back, you may be huffing and puffing. Now you're using more of your lung capacity. That helps your immune system. You're opening up the different parts of your lungs that you normally don't use. So exercise is very vital in terms of being able to help your immune system get ready for this virus. To your point, Dr. Williams, in terms of the vitamins and things like that, it really depends. For most people that have a normal functioning kidney and normal functioning liver, some of the vitamins may not make a difference. In general, you'll see some of the studies that talk about a B complex, and that's kind of all over the board too. So most physicians and most people that are in nutrition would say, you know, you're probably not going to get hurt by a B complex. This is going to sound really strange, but bear with me on this. And I wouldn't say this on open forum if I didn't have the evidence to back it up. Your mother's homemade chicken noodle soup. Now, this is going to sound strange, but they actually did research on the common ingredients that go into homemade chicken noodle, chicken and rice soup, or things like that. And they were able to tease out those ingredients and talked about the specific aspects of the immune system in terms of how they helped fight off a general viral infection. They were specifically looking at outcomes regarding influenza or the common cold. And it was a statistical study that actually showed some benefit. Now, the first thing that we want to be clear on is that we do no harm. So in terms of taking additional doses of vitamins or supplements or things like that, those are conversations you want to have with your physician. You want to make sure it doesn't interact with any other medication that you might be taking. And so I typically encourage people to just kind of ask me off the cuff about that. That's usually my response. For my own patients that ask me about it, again, I look at their medication list and I say, well, let's talk about this. Is there going to be any benefit, risk-benefit over this? Most additional vitamins really don't add any benefit. There are some, but again, it just depends on your health background and what chronic diseases you might have. I don't know, Dr. Laurent, if you had something else that you want to add on that too? Or?
No, I mean, to add to that, again, we're speaking about our general immunity and our general health. As of right now, there is no cure to the COVID-19 illness. You know, the evidence has shown that hydroxychloroquine is not the way that we should be treating COVID-19. So we just want to make that very clear. Remdesivir is an antiviral that is being used in patients who are hospitalized, and there's been some data to support that. So that's why those are the only medications those are the only medication right now that's seen as standard of care. But right now there is no cure, and everything that we do from the aspect that Dr. Speights is bringing up from a preventive thing is what we need to do anyway, right? And it's not to, you know, make us, you know, heal us from this, etc. But this is something that we need to do to maintain a healthy lifestyle anyway. So.
There's one more thing that I would add. We've gotten really good results on something called convalescent plasma. Convalescent plasma is actually the antibodies. So basically, whenever you fight off a disease or fight off a virus, your body produces antibodies. And so we've been able to find those antibodies in patients that have had a robust disease, take them and basically put them in an IV form and give them to people who are really, really sick. We've had really good results with that. That's actually been real positive. You know, it only goes so far, but in terms of those that are critically ill, like Dr. Laurent mentioned, that are in the ICU or on a ventilator or something like that, they've shown really good results. We don't have anything, though, again, back to what Dr. Laurent said, we don't have anything like a medicine you can take by mouth, you know, and that's a couple of things that really kind of, I think people are struggling with. You know, we have a vaccine for the flu, we got medicine for the flu, we got a rapid test for the flu. We don't have any of that for COVID-19. I mean, if you got diagnosed with the flu today, I'd give you a prescription for Tamiflu. You'd go to the local pharmacy and get it. You start taking it. You'd probably be better in a few days for the most part. You know, not true for everybody, but for the most part. And so we're kind of kicked back on our heels, and all we have to really rely on right now is our own immune system, which is why we say it should be in the best shape it can be to be able to fight off this virus.
All right, we certainly thank you. I have to say, this hour has went by really fast. We have so many more questions. I wish we could go a little longer. I don't know what your all schedules are looking like, but if not, then definitely we need to do another one of these because we just have a whole query of questions left. So next, I want to bring in Dominique. She has 3 more questions from the A-State branch. We want to make sure that we at least get those in the time we have left for this one.
Yes, Dr. Dr. Laurent, you and Dr. Speights mentioned NYIT is assisting a state in the plan to reopen campus safely in the fall. Would this plan encourage students to wear face masks? And if so, what advice would you give to the students who find wearing these masks embarrassing or uncomfortable, or they just simply don't want to do it?
Yeah, so our guidelines will be consistent with the CDC. We will not be deviating from that. The CDC is encouraging everyone in public to wear the mask and to appropriately wear it. When you walk in the streets, some people may be wearing the mask and not covering the nose, or maybe just covering the nose. Basically, any orifice or hole in your face is the place that it can be transmitted. So you want to cover all of that as much as possible, not, touching everything and then touching your face and not washing your hands, etc. So I just want to bring light to that. And so we will be encouraging what the CDC has been encouraging the country to do, to wear the mask, to wash your hands for 20 seconds, to do it frequently, to keep 6 feet apart when you're around areas, avoid crowded places. So those are the things that we'll be encouraging people to do.
Thank you. And also, as a student, I know a lot of my peers often choose to cure certain illnesses on their own instead of seeking professional help because they simply don't have healthcare insurance and they can't afford that hospital bill. What advice do you have for students who are not insured but feel they may have some symptoms of COVID-19?
Yeah, so we're saying please get help. Okay, you shouldn't be calculating your bills when you're not feeling well. As a matter of fact, the longer you wait, the more expensive it's going to be. So if you start early on, and there is going to be help, there's going to be access. The care specifically to the clinic that we have at NYIT is open to all students. We're providing care to all students. I don't want that to be a hindrance to our students who are providing care, so please don't wait till the last minute to get the care that you need. Certainly to wait that long would be more detrimental to your health.
And the last question I have, but well, before I ask that last question, you said that NYIT will be opening up a healthcare center. Can you tell us where that is located?
Yes. The NYIT Medical Health Center is where the ASU Student Health Center was located. So it's the same location, and now we have multiple physicians who will be in that location. We have family medicine doctors, we have infectious disease doctors, we have OB-GYN, we also have pediatricians there as well. So we have a multi-specialty clinic with doctors from all different types of specialties that are ready to take care of our patients.
Thank you.
All right.
And our last question from a student perspective would be, usually when experiencing symptoms like the common cold or just allergies in general, students usually attempt to cure this with over-the-counter medicine or even decide to just let it pass. During these times, should students immediately report to that healthcare center or continue to treat these symptoms like they normally would?
Yeah, we've had to address how some of the early presentation of the illness may look like other illnesses. It looks like the flu. Sometimes some people may present like the allergies. So primarily what we know, the most common symptoms for COVID-19 is fever, cough, and shortness of breath. There are other symptoms as well too. Some people are experiencing GI symptoms or nausea, loss of taste, loss of smell, muscle aches. And so because there's a lot of overlaps over illness, don't go to google.com, just call the clinic, talk to someone. I wouldn't go on Instagram and try to figure out what's going on. That's not the safe thing to do. Call the clinic, call your healthcare provider, have a conversation with them, and you'll know the next steps.
All right, we certainly thank you. I'm sorry, I didn't mean to interrupt.
No problem. Go ahead.
Well, we want to thank Dr. Laurent and Dr. Speights. They have agreed to stay on at least until 4 o'clock, so we definitely appreciate them for doing so because we have so many questions that we want to get to. And since we are on the student perspective, I'm going to bring in my intern, Brianna. She's here in the studio, and she has a question.
Hello, doctor. All right. My first question, I heard you guys were talking about antibodies. Recently, I saw it was a couple of volunteers, of people who willingly got injected with the vaccine. They started to develop antibodies. Have you heard anything about that? Would you like to elaborate on that?
Yeah, absolutely. So you're talking about this was in the vaccine testing portion that they were generating antibodies from the vaccine?
Yes, sir.
Yes, ma'am. So that's encouraging news. And so let's talk about that. So the idea behind that is that on a vaccine, and any vaccine, not just the coronavirus or the COVID-19 vaccine, but any vaccine, the idea behind it is that it's injected or somehow introduced into your body, and then your body looks at it and starts creating antibodies. Why those antibodies are important is because when and if you come in contact with the actual virus at some point, you've already got a built-up army. You've already got an army set up ready to say, okay, I'm ready to bring this thing on, I can take care of it. That's been the problem, is that because it's a new virus and nobody's seen it before, all these people that are getting infected don't have antibodies. Nobody's ever seen it before. The vaccine gives you the gives you the ability to build some of those antibodies and really prepares your body for it. So that's encouraging. Now, let's talk about the vaccine for a second, though. The way vaccines are created and approved, there's different phases. There's phases 1, 2, and 3, and they've got to complete all those phases before they can go before the FDA and get approved. Phase 1 means that they try this vaccine out on a few people, maybe a few dozen people. Phase 2, they're going to try it out on a few hundred people. In phase 3, they're going to try it out on a few thousand people. And each time they're going to look back and they're going to say, what were the side effects? Did it work? Was it safe? Was there, did it cause people to get sick at their stomach? Did it cause headaches? So that's all the testing that's going on right now with the vaccines. Most of the information that's out there now says the vaccine won't be available until 2021, in between early to mid 2021. There's been some discussions about a way to accelerate it, and let's talk about that. You don't really accelerate the process of the vaccine, but what you can do, and this is something new, and I'll be honest with you, I've not seen this happen before. If they feel like the vaccine is solid, they've gone through a couple of phases, and they feel like it's a solid vaccine, a company could choose to start mass producing it, because that's one of the things that actually slows down being able to have it for everybody. Because once you go through the phases, then the FDA says, okay, you're good to go, you can now produce it. It takes a while to start producing thousands or millions of doses of a vaccine, as you might imagine. So they can kind of kickstart that. Now, there's a risk there, because all of a sudden we find out that the vaccine's really not it's not safe, not effective, then they they produce all these vaccines that aren't worth anything. But I think in this global pandemic, you're seeing things like that otherwise you wouldn't see, like in a seasonal flu. And seasonal flu and mumps, measles, rubella, and other vaccines, we've got those down. We've created those vaccines. We've done them for decades. We know how to make them. We know how to make them safe and all that kind of stuff. And so we have to go very carefully in how we create this vaccine to make sure that it's safe and effective. And so that's what's going on now. And that's why it takes a while to really create a vaccine. I would be surprised to see a vaccine before 2021. And again, Dr. Laurent and I know are watching all that very closely in terms of the data and the research and everything that's going on behind that. But I'm hopeful that 2021 is when we'll see it, and that's what I think. I think early 2021 we'll see a vaccine, and I think that's really going to change how we approach things after that. Because if we can have a widely available vaccine that's effective and that works for everybody, now all of a sudden the whole thing about I'll be honest with you, the things that we're doing now to limit the spread of the virus, we won't have to be as, overbearing about, so to speak, because, once people get vaccinated, that's really the way to stop the spread of the disease.
Okay, we're going to go next back to our Facebook Live. And we definitely appreciate those on our Facebook Live who have been patient while waiting to try to get through all the questions. Thank you, everyone, to posing the questions and contributing to the discussion. Dr. Sharice Jones Branch says, have these discussions occurred on the ground in black communities? Has anyone gone into black churches, for instance, emphasized the need to get tested, and vaccinated? And pretty much anyone can jump in and contribute to the answer to this question.
Yeah, I think one of the work that we're doing through the Delta Population Health Institute is that when we talk about health, you cannot leave anyone out or any group out. The faith-based organizations within our communities are anchor organizations. It's the place where our place of resilience, quite frankly. And so having an interface and really just health champions within our places of worship is absolutely crucial. I know that Dr. Speights has met with faith-based leaders to discuss how they can take care of their congregants as people are going through different phases. And we essentially just share with them the facts. We just let them know, hey, if you have a group of people in a room, this is what's going to happen. You don't have to tell people what to do. You just say, this is what's going to happen when you have a group of people in the room. And most of the faith-based leaders say, maybe this isn't a good idea for us to all get into the room right now, because I can't guarantee that everyone's going to be 6 feet apart. I can't guarantee that everyone's going to wear the mask or feel comfortable. I can't guarantee that little 6-year-old Johnny is not going to touch little 5-year-old, Billy, and going back and forth with one another, and then bring the germs back home to grandma, even if grandma didn't go to church. So, if you know you can't control those things, right, why put ourselves at risk? So absolutely, those conversations have been had. We need to continue to have these conversations. Laganza, you had brought up a question that had came up before about, the questions have come up about, well, God can protect me. I don't need to wear a face mask. I don't need to, get vaccines. I don't need to get treatment. And I want to talk about that, because I do believe that it's important for us to talk about our faith when we're going through situations like this. That is a point of resilience. It is a point of health. But these things, and our faith was never meant to bring unnecessary harm to us. We are to use these things to walk in faith and to have wisdom. And quite frankly, the discussion about isolation is not a new concept. It's actually a very biblical concept. The people of Israel in the Old Testament, if there was someone who was infectious, they had to separate themselves from infectious people, right, from the rest of the community, so that the community can be healthy, okay, so that everyone else can thrive, so the generations can thrive. So this is a very old, social distancing is such an old concept, and it's probably the most effective way so that we don't spread disease from one another. And then I got another conversation when I mentioned that. Someone said, well, that's Old Testament. What about the New Testament? I was like, well, listen, I don't have a master's in divinity, but I got a scripture for you, okay? So I shared with them, and I said, look, when Christ was baptized, he went to the mountain, and he was being tempted by the enemy, okay? Satan said, if you are the Son of God, jump off of this cliff and let's see if the angels will save you. Christ said, don't test the Lord, don't test God, okay? So that's my response to that. So, I think we really, and then I don't mean to make light of it, because protection, when we talk about our faith and how it incorporates with our health, it's so vital. I encourage those conversations. I teach our students to invite the discussion of faith around health, because it is a point of resilience. People who pray more, they say the study's better, it helps improve their health outcomes. We encourage that, but it should never be used to the detriment or to hinder the wisdom that we get from public health officials or your physicians or healthcare professionals. So I want to encourage people to, yes, walk in faith and walk in wisdom. It's not either or, it's and. God has given us these things and tools to use adequately so that we can make sure that we thrive and continue to do well.
Dr. Laurent, when are you starting your church? And speaking of that, since we do actually have a member of the clergy on our field, I want to bring in our own Reverend Dr. Greg Ota to kind of expound on what Dr. Laurent said. Reverend Ota, you there?
Yeah, I'm trying.
Yeah, you signed on to two of them, so yeah, mute one of them.
Okay, thank you. Yeah, she's right. God gave us wisdom in heaven. He gave wisdom to the people who do science, the doctors and all these people He has given us. They dig down and they find out what the viruses are, how they act, and how to avoid being affected by them. Like she said, I'm pleased she quoted the scripture she quoted. The children of Israel told to stay in the house when the death angel was coming. Didn't mean that God couldn't protect them. He could, but He needed them to comply. So we need to comply to the scientists who know a little better than us and use God's wisdom, and we'll be safe. That's all I have.
All right, thank you, Reverend Ota. Bringing it back to our Facebook Live, Kerry Griffin White says, of the cases in KLEK County, do you know how many are black, white, Hispanic, and other?
So we can speak, I know we can speak to from a statewide number. Sometimes it's hard to get that granular detail, those in the weeds details from the Department of Health. But from a statewide standpoint, the numbers, this is just kind of a general overview. So you look at about, from the numbers like the black side, about 1,800 cases, whites 2,400 cases, Hispanics 278, and then it drops down American Indian, Asian, Pacific Islander, kind of goes down from there. That's kind of the general breakdown for the state of Arkansas. It obviously does differ based on county. And so that's information that you'd have to request from the Department of Health to be able to get, just like, and just so that you know, we at NYIT are partnering with the Arkansas Department of Health to try to look at some of this from a research standpoint. Like specifically, we have interest in some of the things that are going on within the prison populations and some of those details, and looking at being able to kind of dig a little deeper to be able to try to maybe find some more clarity. So right now, that's what it is. Now, one of the things nationally, and this is concerning, is there, and Dr. Laurent has already spoken to this a couple of times, but I want to echo what she brought up, is the disparity under the Black and African American populations. And so, unfortunately, you know, you see different research studies coming out. There's an APM research lab that produced a study that talked about the deaths among Black and African American patients and the disparity between that and, you know, whites, Asian, and Latino. And so right now, the recent numbers are about 50 per 100,000 for Black and African American patients versus 20 to 22 per 100,000 for, like I said, whites, Asians, and Latinos. So that's concerning, and those are things we need to address. Those are issues we need to talk about. We need to start, again, delving into that data from a granular standpoint. Say, what is it? You know, is it the delay in testing? Is it the delay in resources? Is it the resistance to seek out help? I think these are all questions that have to be answered and have to be addressed. And again, I know Dr. Laurent has already spoken to that, but I just want to echo those comments because these are concerning, and it's not something that we need to ignore by any means.
Carrie, this is Emma, and I have access to those county figures. I'll look them up and email them to you.
And Mrs. Agnew, while you're on, let's go ahead and go to you next. You posted a question in the chat, so let's go ahead and go to your question next.
Okay. Well, the question I posted was simply, what is the treatment protocol for people who enter the hospital with COVID-19? What's actually done for them?
So right now, in terms of why a patient, let's back up and say, why would you admit a patient to the hospital? Because we got people with COVID-19 that don't go to the hospital. As a matter of fact, a large number of patients who get diagnosed with COVID-19 do not go to the hospital. So why would you go to the hospital for COVID-19? Well, typically it's because it's a respiratory illness, primarily. Now, I'll talk about that in a second as well. That means it affects your lungs. And so that means that you're not able to take in oxygen like you normally can. So your oxygen levels in your bloodstream would be going down. And so it could be dangerous for you to have low blood oxygen levels for you to sit at home like that. It could increase the risk of a heart attack or a stroke or something of that nature. So you might have to go to the hospital for that and just to receive what we would call supplemental oxygen. There's other things that are going on with this virus which are very surprising to us in the medical community. Unlike the flu, which is primarily just a respiratory illness, this virus is affecting other areas. And again, I know Dr. Laurent has already spoken to this, but we're seeing heart attacks, we're seeing strokes, we're seeing blood clots in the legs and blood clots in the lungs. Really interesting things that typically you don't see with a respiratory virus. So an individual could have stroke-like symptoms, and they get admitted for that, and they're found to have COVID-19. They could be having chest pain. They're having COVID-19, they're diagnosed with that, but they're admitted for their chest pain or for their heart issues. If it's because of the breathing issues, they'll be treated with the oxygen. And obviously, if there's any other underlying disorder that they have, or pneumonia that may or may not be, or that may be bacterial, you might get antibiotics. But we don't use antibiotics for viruses. If they get worse, if their breathing gets worse, which on the COVID patients that we see, the progression is they get worse. Their oxygen levels get worse, even with oxygen by the nose or by the mouth, and they have to get to the point where they can't breathe well on their own. They have to have a breathing tube put down. And so that's, when you talk about the large number of cases of COVID patients, and that's why you may have heard in the national news this shortage of ventilators or a concern about these breathing machines to be able to manage patients. So those patients would then be moved to the intensive care unit. That's not a large number either. So in terms of the patients that get hospitalized, only about 10% or so, depending on the geographic area you're located in, actually end up in the intensive care unit. An even smaller number there actually end up, requiring about half of them end up requiring the ventilator to stay alive, so to speak. And that can, in terms of being on a ventilator, that can be days to weeks, but a fair number will come off. So it's kind of staged. I don't know if that helps you. We would use, as has been mentioned already, the remdesivir, and those would be for patients in the intensive care unit or patients on the ventilator. We would use the convalescent plasma, and those would be for ICU patients or severely ill patients as well. So I hope that helps.
All right, next we will go to our own Quabila.
Okay, I have a question, kind of not necessarily piggyback off the question about the race distribution. However, contact people who have been diagnosed with the virus. Is the health department and CDC contacting people they may have come in contact with, similar to how when people contract HIV/AIDS and other diseases, they basically go through this list of let's contact the person you've been with, et cetera, et cetera. So is something similar happening concerning the COVID-19 virus? I apologize if this has been asked or discussed in previous, discussions.
No, I'll be happy to answer that question. So yes, the Arkansas Department of Health has been tracing patients, specifically those who've been coming in contact with individuals, I should say, who come in contact with those who are positive for COVID-19. So yes, so that is happening. It is one of the greatest tools that we have in public health to help address this pandemic. It helps us find out where a community outbreak or community spread may be. It gives guidance to public health officials about how they need to move forward with their guidance. It tells us what type of specific care or whether we need to increase to more and greater universal testing in a specific site based on the amount of spread. So it really is a valuable tool in public health. And it has been going from the very beginning in the state of Arkansas.
All right, let's go next to Mr. Freer. We haven't heard from him from a while. Did you have any questions? You're muted.
Yes. Actually, I'd like to turn it to Tony and ask him what resources are available to people. You've heard that some folks don't want to go for help because they can't afford it. I'm assuming that the impact economically and in other ways on the Black community could use some help. Can you do that?
Oh yes. First of all, we specialize, I guess you could say, in so many ways here at my employer, College Ridge Development Council, in assisting those who have those socioeconomic challenges, whether it's from a healthcare perspective, whether it's from a utility or rental or a household perspective, we do specialize in that regard. And CRDC is always able and willing to assist those that qualify for a series of programs that we administer on behalf of the state. And so individuals, at this time, we do have a specialized line for individuals or families that are impacted by COVID. And it's outside of our general service line. And so I tell people all the time, just reach out to us at 870-333-5131. That is a specialized line related to COVID. And we have individuals who are specifically going to address the needs of those that are impacted by this pandemic. We have a tremendous partnership with the United Way here in Northeast Arkansas, as well as the Credit County Community Foundation. And so normally individuals have an income threshold that we generally are bound to, but we do have some flexibility at this time because of that partnership to work with individuals who may be outside of the normal income parameters that we are normally bound by. Also, many of our partners have given us a great deal of flexibility in order to work with individuals who are impacted by this COVID pandemic. So I just tell people, play it safe and reach out to us. Don't assume you know what we can do. Don't assume you know what's traditional with our program. You know, people that honestly, in the past month, about 45% of our individuals have been that have received services are individuals who have never received services from our agency. So reach out to us at 870-333-5131, and then let us determine what parameters we have with assisting you. I do have one final question, if I may ask it real quick, because we have gone through a number of different iterations in regards to who should be tested. And so I think it's important for us as a part of contact tracing and as a part of knowing whether or not you are impacted by COVID, that testing becomes vital. So how readily available is testing in our communities, and actually who are the medical community telling today that they need to receive a test?
So we're fortunate. We've got different avenues for testing. Both hospital systems, NEA Baptist Memorial and St. Bernard's, they can do the test here locally. Their clinics have a mechanism to do a test, and actually you call either one of the hospitals. They've actually got a screening mechanism. They go through and ask questions to determine if you need a test. We just started here in Jonesboro. Walmart started the drive-through testing, and so I think that's been posted on the city's website in terms of the dates and times that occurs. And just on Monday, the Arkansas Department of Health here in Jonesboro started testing as well, started drive-through testing. So those are 4 different mechanisms that I can think of off just the top of my head in terms of being able to get tested. In terms of who gets tested, that's been kind of a moving target, but right now we're still adhering to those that have signs and symptoms of possible COVID-19, many of which Dr. Laurent just mentioned. And that information is available, again, CDC website, Arkansas Department of Health. But I will say nationally, and even here in the state of Arkansas, we're not seeing very much flu. So if there are individuals who have flu-like illness, cough, headache, fatigue, muscle aches, shortness of breath, things like that, you should certainly be tested for COVID-19. Fever is one of them. I think this has already been mentioned, but we're seeing some of the stomach stuff in terms of an upset stomach or a little bit of diarrhea or nausea, sick at your stomach. And about 2/3 of the patients, those are presenting signs and symptoms. A good number of patients are having loss of taste or smell. And so if you have any of that, you should also be tested. And so I hope that helps. Dr. Laurent, if you have something else to add to that.
Yes, the Arkansas Department of Health has a map that also shows where there are testing sites throughout the state of Arkansas. I believe if you were to click on one of the symbols, it can tell you what address that you'd be able to, you can call ahead. If you call ahead, perhaps, I'm not sure if every single site has a phone number. Some may be free, some may ask for insurance. Right now, I don't know off the top of my head which ones they are, but I would go to the Arkansas Department of Health website and you can see all the testing sites.
All right, let's now go to Dr. Williams. Did you have another question?
Yes. When you go through the test, can the test give you an idea of the degree? I mean, are you at the beginning of the disease, not the disease, the virus? Are you at the middle of it, or at the end? Or it just said, well, you have it, and you just need to go do your 14 days?
That's a really good question, Dr. Williams. Let me talk a little bit about that. First of all, no, it doesn't tell you where you are in the virus. And one of the other pieces that I think is important is, and we've had this happen already for some hospitalized patients. They keep getting tested, the patients get sicker, and then lo and behold, they end up in the intensive care unit, and finally one of them turns positive. The virus has a strange way of moving, and so it starts out in the nose, and that's where it reproduces. It can be spread through the eyes, though that's very rare, but it starts out in the nose. It actually migrates. It moves down the back of the throat and down into the lungs. So it could be that the virus has gotten so severe in terms of the back of the throat and into the lungs that a nasal swab won't pick up on it. And so that's why we encourage early testing. So that's why we say, look, if you think you've got symptoms, you need to go get tested. Because we've had people that wait too long, and then they go to get tested, and the test is negative, but they're still sick, and then they get sicker. and they're actually COVID-19 patients, but the virus has moved. So anybody that has these symptoms and that have been listed on the CDC website and the Arkansas Department of Health that thinks they may be sick needs to get tested. And that's why you see the drive-through testing, the testing in the Walmart parking lots, the availability now that we're increasing to be able to get tested. We're trying to make sure that it's available for anybody that wants to get tested.
All right, let's bring back Dominique now. I know that you had asked your question. I don't know if there may be any new questions from the A-State student body that you may have a follow-up yourself.
Yes, Dr. Speights, following the instructions and advice you and Dr. Laurent both gave, if a student calls the NYIT Healthcare Center and is instructed to come on in and get an official screening, but they do not have insurance, will the bill be added to their student account balance, or will they have access to a separate payment plan without going through A-State? How does that work?
So we have worked with ASU as we've moved into this to make sure that basically, no red wolf left behind, so to speak, no student left behind. So we want to make sure that students get the care that they need, certainly not just now, but all the time. And so we'll work with individual students in terms of specifically those that don't have insurance. Very much similar to the way that it was before NYT moved into that clinic in terms of receiving a bill or not receiving a bill. Prior to us taking over, if a student came in, they would not get charged for the visit by the provider. They may have to pay for the lab fee. So if they got blood drawn or had a swab done or something like that, there may be a cost associated with that would show up on their student account. And we plan to honor that. We don't plan to change that at all. But if a student does have insurance, then it is our plan to apply that to the insurance. But again, we plan to work with each student on an individual basis to make sure that they get the care they need. So it's not, I want to be clear. When the student walks in and says, look, I'm sick, that student's going to get seen. It doesn't matter if you've got insurance or not. We're going to take care of the student and make sure everything's okay. Our first priority is the well-being and the health of the student. And so everything else comes secondary behind that. Does that help?
Yes, and also will NYIT be sending out an official email to students detailing that information, or how is that information supposed to be broadcasted to the student body?
That's a great question, Dominique. I'll be honest with you, we expected to have all this done, and Dr. Williams could speak to this a couple of months ago, and then we got into the middle of this pandemic, and all of a sudden now the majority of ASU students are off campus, and we got our physicians getting pulled in other directions. And so we've had to now just kind of come back to the plan that we were trying to initiate there in February and March. So to your question, yes, ma'am, we'll be communicating. We try to work closely with the chancellor's office to make sure that communication is in sync, and making sure that ASU is putting out the correct information, that we have, and make sure we're saying the same thing. So we will be working with ASU to make sure that students get correct information on how that's going to work in the clinic. Like I said, I'm excited about being able to provide that. I'm excited that Dr. Laurent is involved in those committees and making sure that we can provide those services to the students on the ASU campus. So we will be getting that information out. Yes, ma'am.
All right, Dominique, did you have any other questions? Want to make sure that we definitely hear from our A-State Red Wolves.
On the behalf, we actually have no further questions, but on the behalf of Arkansas State NAACP as well as Arkansas State student body, we would like to thank Dr. Laurent and Dr. Speights for their time and their answers.
And we certainly thank you and A-State NAACP for their participation. Going next, we will bring to Mr. Freer, who has 2 questions. And remember to unmute yourself first. And I think he's going on a tangent, does not realize that he's muted. So I think he still doesn't realize it. You just said a whole paragraph muted, so you're gonna have to start over.
Try again. Any more myths you want to dispel? And second, are we opening up too soon in Craighead County?
Well, I think that, and I'm not going to speak for Dr. Laurent, I'm going to let her answer this as well. I think the biggest myth that I want to dispel is the virus is not gone. In fact, we're seeing more of the virus in our community. We're seeing more of the virus in Craighead County, and we can expect to see additional cases. And really, in terms of it, I've gotten asked this quite a bit: are we opening up too soon? I don't know that it's a case of opening up too soon, as opposed to what you do when you open up. There are financial consequences to remaining closed that impact everybody, and there are a lot of negative impacts. We're seeing studies now coming out about spousal abuse, about child abuse and things like this in lockdown states, not specifically here in Arkansas, but in states where they were under lockdown. And you got to remember, just a few weeks ago, 95% of the United States was under some form of lockdown. So it's over 313 million people were in some sort of stay-at-home order. And there's a lot of things that go along with that in terms of the depression and the anxiety, not to mention the fact that people aren't getting a paycheck. And so there's just a lot of things that have to be weighed when you talk about that. So I like to shift the conversation more to, okay, we need to open up. So what's the safest way that we can do it to protect ourselves, protect those around us, to protect our families, and try to still continue to limit the spread of the disease, while we're, moving our economy forward and while people are going back to school and getting an education and those kinds of things. And so I think that's a bigger piece of the discussion. I don't know, Dr. Laurent, did you have anything or that you wanted to add to that in terms of what you think what the biggest myth is that you've heard?
Yeah, I want to just echo that. I think, and the myth kind of goes in line as, messaging has come across about the state opening. I think there's this false sense of security that as things are opening up, restaurants, etc., it seems as if it's almost come across as a green light, and that's not the intention at all. We're actually seeing an uptick right now in our region as things are opening up. The cases are increasing. We expected that. And when we are relying on every individual to take the responsibility to wear the masks, to distance themselves appropriately, avoid large gatherings and long lines of people. If people aren't doing that, I'm very concerned as a physician that the numbers are going to go up significantly, and beyond our capacity, which is always our concern from the very beginning. So I do want to just echo again what Dr. Speights has mentioned, that we do have to be cautious as businesses are opening. There are guidelines on the CDC. If you are a business owner, what you can do to support your employees and your patrons when they're entering into your place of business. If you're an educator, if you're overseeing school districts, there are guidelines that I encourage people to go on the CDC to see about what does it mean to create a safe space for your faculty, your staff, and for students and teachers. The difficult thing to navigate is that every school is different, every district is different, every business is different, and it does create some level of innovation and, quite frankly, resources to be able to meet the needs of your patrons and your employees. It's always an interesting thing where I find that we look at that graph. I think we've all seen that graph of capacity for hospitals. I'm looking for a graph that looks for capacity for workers who are in the groceries, for workers who are in retail, because they have graphs too that we haven't seen. And if they all become ill, we need people, to be in place to carry out our daily functions as well. Manufacturing companies and, schools, et cetera. If all our teachers get sick, we have a problem. If all our people who are working get sick, we also have a problem. So we want to make sure that everyone puts safety as a priority in their workplace, in their businesses, because this virus has not gone away.
All right, and as we approach the 4 o'clock hour and we wind down this discussion, wanted to bring in Mrs. Agnew, the president of the Craighead County chapter of the NAACP, for either a final question or just final thoughts, and then we'll close out with final statements from both Dr. Speights and Dr. Laurent.
Thank you, Leganzi and Dr. Fear, for putting this forum together. And a big special thank you to our special guest, Dr. Laurent. Is that how you say it? Am I saying it right? And Dr. Speights. I want to thank you all so much for the information and sharing your valuable time with us. I know how busy you both are right now. And thanks to each one who took time to sit in on this call, and also those who are listening. I do think that it would be beneficial if we could plan a follow-up sometime in the near future. I know there are still questions out there. And as I said at the beginning, we know that education, just educating people, especially our Black communities, about this virus is what's going to help most. Is for them to have the facts, to know where to go get the facts, to know who and what they can trust and who and what they can't. And so, you know, having someone speak to the churches is fine, but the churches aren't meeting right now. And so we have got to figure out a way to reach the masses, to let them know that there is help available, there are resources available, there are educated professionals who are willing to talk with them, and that there are organizations who are willing to direct them in the right path. So thank you, Dominique, Dr. Freer, excuse me for leaving your name off at first, Dominique, Dr. Freer, and Leganzi for putting this forum together. And thank you again to our wonderful doctors. Thank you. That's all, Leganzi.
All right, and speaking of those doctors, let's hear from both of them.
Well, we've said a lot of things already. I just want to say that, these dialogues should happen ongoing, not only when there's a pandemic. We should continually have these things from a preventive perspective all the way through. I think what we're seeing right now has to do with the fact that we are operating in silos, and it's hard to get the information out because we're operating in silos. So I hope these conversations happen throughout the pandemic, after the pandemic, so that we can continue to build resilience.
And I think the only thing that I've got to add is I'm going to say what Ms. Agnew said, ditto. She did a great job basically summing it up, saying, look, this really revolves around education. It's about education. It's about, and certainly we'd be happy. I know I can speak for Dr. Laurent. We'd be happy to come back because it's an ever-changing topic. I mean, we have to keep up daily. I mean, we get up the next morning, there's things that have changed, new research out, new information out. And so we've got to make sure we get that and digest it, put it out in a format that the public can understand. And we feel like that's part of our job, certainly as the academic medical school here in this region, to do that. It's our job to give back to the community that supported us. So thank you for your comments, Ms. Agnew, because I agree wholeheartedly that I think a lot of it boils down to education, and so we just need to keep pushing that out. So thank you guys for the opportunity to do this. We really appreciate it. If we can have the answers or have some of the information, but if we don't have a platform or have a way to get it out, then it doesn't go anywhere. So we're very appreciative of the opportunity to speak to you today.
And we certainly thank you all for taking part in this. Thank you to everyone that participated on our forum. Thank you to everyone that tuned in either on 102.5 FM or on Facebook Live or even on Instagram Live. We are live on Instagram. We were, at least for the last 30 minutes. Again, we will do this again, and we will have more information on the KLEK Facebook, social media and Facebook, all that good stuff, as well as both the Craighead County and the Arkansas State NAACP page as well. So just watch all of that for the latest, and everyone stay safe. Thank you all once again, and you all have a great and blessed day. This is KLEK 102.5 FM.